Good afternoon, everybody. And this is our privilege, and this is a very good opportunity to be here for myself and my organization to welcome Dr. Shunichi Toriyabe. He's an inventor of rat therapy, as he says, from Japan. And we had an invitation to him from Kathmandu Hospital and Jaika, Nepal. So he has accepted our invitation and has come to Nepal and in our institution in Kirtipur also today, so that we can share his knowledge on the rat therapy, the skill, and also the experiences which he had gained for many years. So Dr. Toriyabe is medical director from Osaki City Hospital in Japan, and he is a medical director. And after he has graduated, he has done his MD. He was designated, or he was posted in a community hospital for some years, and he has encountered many cases of elderly people and also disabled people with bed sores. So, as he says, that was enough evidence that he could work on that difficult non-healing ulcers and also other kinds of wounds, burns, and also surgical wounds, which can be treated with advanced or modified kind of wound healing methods. So with this experience, only after 16 years, the rat therapy was recognized in Japan. That was published in different medical journals and also in textbooks and also educational curriculums and all. So we feel proud of him. He has worked very hard, and for many years he had done researches on this ground, and he has a big knowledge on this. So he wanted to share this in our in Nepal and especially in Kathmandu, and that was also initiated by a Jaika volunteer who were working in our institution for 2 years before. And Mr. Watanabe, he was a physiotherapist, and he also was very much influenced with this therapy, and he tried to provocate. He gave some lectures, and also he visited different hospitals and talked about this. And that instigated Dr. Toriyabe to come here in Nepal. So anyway, maybe it's a long history that about wound, I do not want to go to that. But we recognize his effort, Dr. Toriyabe's effort to establish this rat therapy. And so far I understand this is a very simplified way of treating wounds and burn injuries. Simple wounds, primary wounds that can be treated with this non-interference technique, and it is maybe called the natural way of treating wounds. And we always try to explain things in to be in a natural way. Like these are now becoming very much important that even the new baby, the obstetricians and the delivery also is now considered to be effective, and we are trying to be very much natural, and we say natural birth. So similarly, this wound can be treated also in a natural way, so that this lab therapy is trying to advocate on this line. So I do not want to go much and have time. So this is a small words I wanted to speak about Dr. Toriari. So let us welcome him. Let us welcome him and have a very warm welcome to our institution and in Kathmandu. Let us give a big hand to him. Thank you very much. Thank you very much. And we have enough time to listen to him and have a good discussion, whatever we feel that questions on the answer. Thank you very much.
Thank you very much for Dr. Pravat Pradhan Director. I'm flattered and honored to detailed introduction. Thank you. Namaskar to all Nepalese people concerned with wounds, burns, and dead souls. I'm so-called invited by Dr. Pravat Pradhan, Director of Kathmandu Modern Hospital and JICA Nepal office to visit this country to share my knowledge and experience on rap therapy with medical professionals here and caregivers here. Wound care has advanced in the past 50 years and appears to have changed the world of wound care. New treatment modalities and new wound dressings are proposed by every year. According to dressing manufacturers, wounds can now be cured better and painlessly with modern dressings. It may be true for people in wealthier countries, but it is not so for those who are not rich enough to have access to expensive medical products. Rap therapy is a solution. Its idea is based on contemporary wound care science, and it gives better outcomes and is still cost-effective. You may have concerns about this rather new medical technology. The concepts may appear to be quite contrary to conventional medical practice. Moist versus dry, plastic film versus cotton gauze, simple water versus disinfectant, systemic antibiotics versus topical antibiotics or disinfectants. Concerns among medical professionals, especially among wound specialists, might be endless. We share exactly the same dilemma among medical professionals in Japan. It has taken more than 16 years for medical societies to allow rap therapy in their clinical guidelines. There is still a persistent opposition from wound specialists. Therefore, it is impressive to me that rap therapy has taken roots in Nepal after introduction by JICA volunteers Noriko Maeda and Osamu Watanabe and their colleagues at KMH, Amrita Tupamo and Kailash Sintapa and their colleagues a few years ago. Rap therapy, I believe, meets medical needs in Nepal if used properly. Especially experience on without further ado, time is limited, so let us take advantage of this opportunity for the betterment of healthcare in Nepal by sharing the lessons learned through the care for patients with wounds. So let me allow to sit down. I have to compatible with the computer system. Okay.